Hello everyone, welcome back to my channel. In this session, we will be discussing about some of the important questions which can come for the exams from neuroanatomy. Okay, and I would like all of you to go through the entire chapters at least once so that it will be easy for you to go through the sure shots. When I say sure shots, that doesn't mean that you need to study only that. This is just for exam purpose. So before going for the sure shots, make sure that you know the topic very well. Okay, so that is very important. So sure shots, it's mainly for exam purpose, so that the day before the exam you can just brush your memories by focusing some of the important questions which can come for the exam. Okay, so in this session I am planning to discuss about neuroanatomy topics. The book which I would like to follow is Textbook of Clinical Neuroanatomy, 3rd edition by Dr. Vishram Singh. Okay, so this is the book which I used to follow, and of course you can follow Neuroanatomy by A.K. Datta, but for UG level it will be a bit hard to crack. So this book I really found it useful. So if you like, you can get this book and try to read yourselves. So the initial chapters in this book are mainly focusing on the development of the nervous system and some general anatomy topics. So general anatomy topics I'll be giving you a session, another session. So for the time being, I'm just focusing on the neuroanatomy. So the development, the embryological aspects, I'm not dealing with it right now because I've already done a video on the must-know topics from embryology. So please go through that. So we'll start with chapter 7, the spinal cord. Okay, so from the spinal cord, you should know the levels of the spinal cord. Okay, this diagram is beautifully given out there, depicting the positional changes of the spinal cord at various stages of development. Then you should know in detail about the spinal meninges. Okay, and when you read about the spinal meninges, you should be able to draw a diagram of spinal meninges. Then if you check this tabular column, the differences between spinal and cranial dura, always asked, you should know that concept. Okay, then lumbar puncture can be asked as a short note. What are the layers pierced when you insert a needle for lumbar puncture? That also very important. Then another question which can come is processes of pia mater, or the special parts of the pia mater like phylum terminale, subarachnoid septum, linea splendens, ligamentum denticulatum. You know the 4 specifications, isn't it? So that is very important. Then coming to the external features, you just know what are the specialities of the spinal cord when you look from the outer aspect, and in detail you need to know the vertebral levels of the spinal cord segments. Okay, at which vertebral level each segment corresponds to, that is very important. Then you should know about cauda equina. What is cauda equina, what are the nerve roots which you get in the cauda equina, and something about cauda equina syndrome. Now coming to the internal structure of spinal cord, the grey matter, I have done all these sessions in the YouTube except for the ascending tracts. I'll be doing it soon. Many of you have asked me, I will be doing it soon. So the grey matter, how it's arranged, the different levels of nuclei, how are they arranged, and so you should know in detail about the Rex lamina, not in detail, just this tabular column as well as one diagram depicting the relation between the nuclei and how it's grouped under Rex classification, that also you should know. Then coming to the tracts of spinal cord, again one beautiful diagram is given there. You have to study that diagram along with the classification of tracts. You know there are descending tracts as well as ascending tracts. You should know the example of each, and along with that special mention to the corticospinal tract, the pyramidal tract. It can be asked as pyramidal tract or corticospinal tract. Then what will happen if you get a lesion in the corticospinal tract? Then again a diagram for the same, it's given there. It's very good diagram because if you happen to study that single diagram the day before the exam, if you just have a look at that diagram, you need not go through the entire written matter. Okay, that itself is self-explanatory. Coming to the ascending tracts, there you should know about the spinothalamic tract. It is again asked. Then one more ascending tract which you should know is the posterior column, the fasciculus gracilis and fasciculus cuneatus. That is also very important. Spinocerebellar tracts, just this diagram will help you to know the difference between how these anterior and posterior spinocerebellar tracts ascend and what are the changes happening to these tracts, which one is first crossing and which one is last crossing. That just that concept you need to know, and just one or two functions of the spinocerebellar tract. You need not go through the entire thing. With the help of this diagram, it will be easy for you to brush the day before the exam. And again, after studying in detail the ascending and descending tracts, if you compare and study these two diagrams, then with the help of these diagrams you can explain the entire thing. So the day before the exam you can just brush up through those diagrams. Coming to the clinical correlation, syringomyelia hemisection of spinal cord, that is otherwise known as Brown-Sequard syndrome, likewise Tebis dorsalis. These three are usually asked. It can come as a part of structured essay or it can come as a part of short answers. Okay, that is also very important. Coming to the arterial supply, you need to know which are the arteries supplying the spinal cord and the area of the extent of supply of each artery along with the anterior spinal artery syndrome. That again, with the help of this diagram clearly depicts the extent of distribution of these major arteries. And you should also know what do you mean by the artery of Adam-Kiewicz, because according to the recent MCA curriculum, you will get 1 mark questions as well. So sometimes the artery of Adam-Kiewicz can be one word answer for some of the questions. So please know that also in detail. And the venous drainage, which are the major veins draining. So when I say venous drainage, of course you would have studied the entire topic, but the day before the exam you just go through the main branches and tributaries, because that is the only thing which is possible the day before exam. You cannot go through the entire text. So but when you read the text the day before the exam, you will feel like you have to read the entire thing so that you will remember. But don't worry, if you have studied it thoroughly, the day before exam you just go through the headings and subheadings. Don't bother whether you will remember the matter which is written under it. You will definitely remember, but if you are not able to go through the subheadings and headings, then it might be a little bit difficult for the when you write the exam, because the important points might not come into your mind. So the only thing which you have to keep in mind is the day before exam, make sure that you read at least the headings and subheadings and finish the entire portion. Okay, don't bother about what is written in explanatory manner under these headings and subheadings. And all of us will have a tendency to read the entire thing which is written under it, because a day before exam we feel like we don't remember anything. Okay, but I assure you, please don't worry about it. Just leave that part. Then just go through the headings and subheadings. That will brush your memory. Now coming to the next session, brainstem. Brainstem, first and foremost, you should know all the sections of the brainstem, whether it be midbrain, pons and medulla. Be thorough with all the sections of the brainstem. So whenever one question is asked, you can at least draw that diagram and can write something about it. So believe me, always be thorough with all the sections of the brainstem. I have done a session. If you want, you can go and have a look. So in this session there are tabular columns where the components of the sections are given in detail. So you just go through the components the day before exam, like what are the grey matter components you get, what are the white matter components. You need not go through the written matter. Okay, so just this tabular column the day before exam will help you to brush your memories. Then the internal structure, of course, all the sections you need to know in detail. Then first coming to the medulla oblongata, you should know what are the major events happening at the level of pyramidal decussation and sensory decussation. That you have to know. Then the clinical correlation, you should know what do you mean by lateral medullary syndrome, what do you mean by medial medullary syndrome. They are the other names, the synonyms of these syndromes, like Digerin syndrome, the syndrome of Wallenberg. That also you need to know, because sometimes you might be knowing everything about the lateral and medial medullary syndrome, but you won't be knowing the synonym. Then you might land up in trouble. Okay. Now, when you go to the pons, again, you first have a look at the tabular column, the grey matter, white matter. That will give you an idea the day before exam. Then you study the diagram. That's enough the day before exam. Then you should know about neurobiotaxis. It was once asked as a short note. Then coming to the applied aspect, the blood supply of each region of the brainstem you should know, then only you can clinically correlate with the syndromes. So here you need to know about Millard-Gobler syndrome, the pontocerebellar ankle syndrome, and the pontine hemorrhage, because these can come as a part of structured essay as well. Coming to midbrain, again first you have a look at the tabular column where the grey matter and white matter is mentioned. Then here you should know about the crus cerebri, substantia nigra. These can be asked as a short note, crus cerebri and substantia nigra. Then coming to the next topic in this chapter, that is medial longitudinal fasciculus. This is a very favorite question for most of the examiners, which are the nuclei involved in this fasciculus, cranial nerve nuclei. That also very important. Then along with the blood supply of midbrain, you need to know about the Weber syndrome, Benedict syndrome, Perinard syndrome, and what do you mean by Argyll-Robertson pupil. So even if you don't know the details of each, you should know where is the location of, in order to get the syndrome, which are the vessels affected, which are the main components affected. Okay, like that 1, 2, 3 you just make points and study. Coming to the functional components, the nuclei and distribution of cranial nerves. Again, if you go with the general somatic efferent, special visceral efferent, if you haven't studied the day before exam, then it will be very difficult for you. So always have a thorough knowledge of this chapter like the other chapters, and the day before exam I prefer you all to just focus on this diagram, because it beautifully depicts how these nuclei are arranged and what are the cranial nerve components. This is enough for you for the time being, because from undergraduate level this is what we expect from you. Okay, so if you know to draw this diagram, you can first draw this diagram and you can explain just this diagram. That is enough. No need to go through the entire topic. Now, some of the topics which can be asked as a short note, 2 marks or 1 mark question are, you might get what do you mean by nucleus ambiguous, what do you mean by Edinger-Westphal nucleus, like that you can get questions. Okay, and also nucleus of solitary tract, NTS, nucleus tractus solitarius, that also you can get. Now coming to the cranial nerves, some of the important cranial nerves which you should know are, you should know the optic nerve. Optic nerve, what are the lesions which you get at different levels, that you should know. Then trigeminal nerve, you should know what do you mean by trigeminal ganglion, what are the divisions of the trigeminal ganglion. Then what do you mean by trigeminal neuralgia, that also you should know. Coming to the facial nerve, it's very important, the entire course of the facial nerve, what do you mean by Bell's palsy, what is the difference between UMN and Lemon palsy in facial nerve, that you should very definitely know, because you know about the difference in motor innervation, what is happening in the UMN. This diagram clearly defines the condition. Okay, so for facial nerve, you should know the difference between UMN and LMN lesion. That's very important. So the rest of the nerves, the day before exam, you need not stress much on those nerves, because these are the usually asked questions. Coming to cerebellum, cerebellum again, you should know the anatomical classification and the functional classification of cerebellum, and the tabular column will give you an idea about the subdivisions of lobes or lobes of the cerebellum and the cerebellar corresponding cerebellar vermis part. So you should know the morphological division as well as the anatomical subdivisions of the cerebellum. Then the components of nuclei. Again, this tabular column will help you to know the nuclei connections and functions. Just by looking at this tabular column, you can brush up your memory very fast. Then coming to the internal structure, you should know when you study the histology, you will be studying in detail, but for the time being, you should know which are the major layers coming in this session. That is how the nuclear arrangement is made possible. Then another short note which can come from this area is intracerebellar nuclei. You know, D, G, F, dentate, emboliform globose, festigi, that is a code for that. When you come to the connections of cerebellum, you better study it with the help of correlating with the peduncles, the cerebellar peduncles, superior, middle and inferior cerebellar peduncles. So when you go through this, I will be doing a session, don't worry. So when you go through these cerebellar peduncles, you will be seeing many sort of nerve fibers, but don't worry, you need not mug up all the nerve fibers. Just know which are the chief set of fibers passing through it and just some of the major examples with it. Then arterial supply, which are the major branches supplying the cerebellum, and what are the disturbances you expect, what are the syndromes or what are the characteristics of these syndromes when archicerebellum is affected, paleo, neo, like that you should know. So that when you get a structured essay, you will get to know which part of brain is affected. Coming to the fourth ventricle, you should know about the recesses of fourth ventricle, the floor of fourth ventricle or rhomboid fossa, and the relations. This diagram is very important. It can be asked as a draw a diagram itself. Then what are the connections of the fourth ventricle? Then coming to the next chapter, the thalamus. Thalamus, you need to know about the thalamic nuclei. How are these nuclei placed? And the important thalamic connections. Okay, which among the nuclei we know that the important ones are the ventral posterior nuclei, ventral posterolateral and ventral posteromedial, that you should know in detail. Then about medial and lateral geniculate bodies. These are the important topics from the thalamus. Then you should know what you mean by thalamic syndrome. Then medial and lateral geniculate body you should definitely know in detail. Then coming to the hypothalamus. Hypothalamus, you need not mug up the entire thing, just this tabular column will help you to know the regions and nuclei. Which are the regions of hypothalamus and which are the nuclei corresponding. You just focus on this tabular column, that will be easy for you. Then coming to the connections of hypothalamus, hypothalamo-hypophyseal portal system. That is usually asked. What do you mean by that and how is the mechanism? You should know. Then craniopharyngioma, the remnants of the Rathke's pouch, you know that. That also you should know. Coming to the third ventricle, you focus on this diagram which depicts the boundaries of the third ventricle. That is enough. The day before exam, just focus on that diagram. It will help you to write at least 10 points. Believe me, if you study that diagram, with the help of that diagram, you can write at minimum 10 points. Coming to cerebrum, you should be knowing about what do you mean by lateral sulcus of Sylvius, central sulcus of Rolando, what do you mean by calcarine sulcus, then what do you mean by island of Rheel, insula or island of Rheel. So when these questions are asked, you should know where to mark in a diagram and just 3 or 4 points about each. Then coming to the different regions of the cerebral cortex, that is more for the practical session. For theory session, you should be knowing about the layers of the cerebral cortex, that comes in histology as well. The different layers of the cerebral cortex, the functional areas of the cerebral cortex also, and specifically the functional areas of the frontal lobe, the functional areas of the parietal lobe. These two are very important. And among that, again, you might get you might be asked to write a short note on motor speech area of Broca, sensory speech area of Wernicke. The comparison between Broca and Wernicke is given in a tabular column. And so this tabular column itself is self-explanatory. You can go through it. Then in the occipital lobe, the primary visual area, you have to focus. Then what do you mean by cerebral hemisphere dominance? You just be ready with 3 or 4 points from that, cerebral hemisphere dominance. Coming to the next chapter, the basal nuclei or basal ganglia. This flow chart will give you an idea about the basal ganglia. So if you just focus on this flow chart, it will be easy. It will just help you to fresh up your memory. And the next page, a beautiful diagram showing the relations of the basal ganglia is also given. So you should know what do you mean by caudate nucleus, what do you mean by lentiform nucleus. So this can be asked, what do you mean by caudate. So if caudate nucleus is asked, you can write about the caudate nucleus, then you can talk about the basal ganglia, you can talk about the connections. Likewise, lentiform is asked, you can mark the lentiform nucleus, then the same thing, the basal ganglia you can talk about. The connections of corpus striatum, the efferents and efferent connections. Then Parkinsonism, that is a very important topic. Then coming to the white matter of cerebrum, You should know what are the different types of white matter fibers, association, commissure and projection with examples for each. Just study the different examples, and in detail you should know about corpus callosum. Then internal capsule. Internal capsule is a very favorite question. It can come as a part of structured essay as well. Then parts of internal capsule, the components of the internal capsule, both the motor fibers and sensory fibers. I have done a session, please go through it. Then the arterial supply of internal capsule and the lesions of the internal capsule. Okay, so internal capsule itself is a very, very important topic. Please don't go for the exam without reading internal capsule. Coming to the lateral ventricle, the different parts, especially the central part of body, you should know to draw the diagram as well. Coming to the blood supply of brain, the very important topic which comes under this is circle of Willis. You should know how to draw the diagram of circle of Willis. Then just study the important branches of vertebral artery, the basilar artery, the internal carotid artery. Just focus on the different branches. Again, if you just have to have a look at this tabular column, it is given, the entire thing is given there, and you just study this diagram where how these arteries are supplying the different parts of the brain is depicted, which is dominating which area, like that. Then what happens if there is an occlusion of the anterior cerebral artery, middle cerebral posterior, which are the main symptoms, that also you should know. And what do you mean by cerebral angiography? Because since according to new curriculum, up to 100 marks questions you get, all these questions can come. Then coming to the venous drainage, great cerebral vein of Galen is very important. Then what do you mean by subdural hemorrhage? And what do you mean by blood-brain barrier and blood-CSF barrier? Both the differences you should know. Coming to the meninges and cerebrospinal fluid, the dural folds, all the four, false cerebri, false cerebelli, tentorium cerebelli and diaphragm are very, very important. Then coming to the sinuses, cavernous sinus and its relations, because the symptoms might present like that. The pulsating exophthalmos can come as a part of the structured essay as well. Now coming to the, then one more important point here is the cisternal puncture. The subarachnoid cisterns, the different subarachnoid cisterns, especially the cerebellomedullary cistern, the cisterna magna, then cisternal puncture you should know in detail. When you come to the CSF, you should know this diagram, just a rough schematic representation, and this flowchart will help you to write something about the CSF. And hydrocephalus, the different types of hydrocephalus, both internal and external, very, very important, you might get. Then coming to the next chapter, that is just again a recap of the somatic, motor and sensory we have already discussed in respective chapters. Coming to special senses, again we have discussed, we have mentioned about the optic nerve. You should know the different lesions, what happens along its course. Then one important point here is you should know about the visual reflexes. In physiology also you are studying that. So the visual reflexes and its pathway. Okay, so these pathways, the flowchart as well as the diagram, and the lesions. This is very, very important. Please go through all these things. So that's then coming to the limbic system, the reticular formation. What do you mean by reticular formation? Just mention the components of reticular formation, the efferent and efferent connections. Then the limbic system, I have done a session, and when you come to the limbic system, the amygdaloid nuclear complex, hippocampal formation, fornix. These are the three topics which you should know in detail. Okay, I have done a session in the limbic system. Please go through that also. So these are the must know topics which you should be knowing when you appear for the neuroanatomy exam, and the day before the exam you can just stress on these important topics, but I always ask you to have a thorough knowledge of the entire topic, then only you will find it easy to brush through the important ones the day before. Okay, so and always study with the help of a diagram, and always try to draw and study the diagram, because if you just see the diagram in the examination hall, you will find it difficult to complete the diagram. Okay, so always have a scribbling pad and you just draw and study the diagram. Don't bother whether it is beautiful or not, just make sure that you are drawing the diagram. So that's all about the important topics from neuroanatomy. Please leave your comments if you like this session. Those of you, if you haven't subscribed, please do subscribe so that it will motivate you to do more and more sessions. And I'll be coming up with the rest of the important topics and how to write the exam. And of course, I'll be finishing the topics which are pending. Due to time constraints, I'm not able to do, but I promise I'll be doing all these topics. Okay, and thanks for your valuable feedbacks. I really feel happy reading your feedbacks in the comment section, because whenever I read one feedback, I always feel motivated, because for teachers, their strong motivation is the feedback from their students or listeners. So you are always trying to motivate me through your valuable comments. So please do continue the same, and thank you and thanks for watching.